Hi again, and thanks for joining me for this second presentation in which I'll be telling you a little bit more about the educational and mentorship opportunities that you'll have as a fellow at Emory. In addition to the weekly multidisciplinary critical care conferences and the pulmonary grand rounds that I told you about in the prior slide presentation, our program offers several educational courses geared towards first-year fellows. The bronchoscopy course is a regional course that fellows travel to and where they spend time with expert faculty to learn bronchoscopic anatomy and techniques. Aside from the fact that it is very informative and educational, this course, which usually happens in mid-July, has historically served as a major bonding experience for our first-year fellows. The ultrasound course is usually held every September and is led by our local expert faculty in our own division. Here you will get an introduction to the theory behind ultrasound and you will practice your skills on standardized patients. This course serves as an introduction to the concepts of thoracic, cardiac, and abdominal ultrasound, as well as basics of point-of-care ultrasound. The Vital Talk workshop is led by faculty in our palliative care division and is aimed at improving communication skills surrounding conversations about goals and values in the ICU. Although the first time we offered this course, fellows were a bit skeptical about its benefits, it has been a very highly rated experience. So much so that senior fellows have elected to repeat the course later in their training. And finally, the cadaver course. This is a yearly experience that is offered to the first-year fellows, and it's designed to teach them advanced skills for intubation and chest tube placements. One topic that candidates on the interview trail are more and more interested in knowing about is the exposure to extracorporeal membrane oxygenation, or ECMO. There is a well-established ECMO program at Emory, led by our anesthesia and surgery critical care colleagues. Our own critical care fellows will be exposed to patients on the ECMO circuit during their rotations in the cardiothoracic ICU. For senior fellows who are interested, an ECMO track is available that allows you to gain more experience with cannulation and transport. Fellows accepted into this track will go through an ECMO boot camp in July of their senior year and will take regular call throughout that year to respond to ECMO patient evaluations, cannulations, and transfers. If you enjoy teaching or if becoming a clinician educator is in your future, you will find a lot of opportunities to be involved in teaching with multiple levels of learners. Our division includes multiple medical school course directors for both pulmonary and critical care modules. Interested fellows are regularly recruited to help with teaching, curriculum building, testing, and grading medical students. The residency program also has opportunities for fellows to be involved in teaching interns during the onboarding process, as well as both interns and residents throughout the year. Our fellows have regularly won teaching awards from both the medical students and the residents, which is a huge testament to our fellowship's involvement in the educational mission of both medical school and residency. As you will soon discover, fellowship is quite different than residency in many ways, and an important difference is in the sheer number of peers that you get to interact with and that are available for advice and support. Unfortunately, and you can believe me, that number gets smaller and smaller as you advance in your training. So in order to give you a solid support system when you join us, and because we care about both your professional and your personal well-being, we've created a mentorship model we call the houses. Each house pairs a few fellows, usually a mix of junior and senior fellows, with 2 faculty members who will serve as the mentors. The houses are designed to provide life and personal mentorship and are separate from the career mentorship structure that we will talk about next. Houses have a social meeting at least quarterly, and the fellows within a house serve as each other's support group, sort of a big brother, big sister kind of model. For more structured career mentoring, you will be assigned an academic mentor by our Career Development Committee, or CDC. The CDC's goal is to ensure every fellow has well developed career goals and stays on track to achieve them. Your academic mentor will serve as your liaison to the CDC and will help you navigate the division and Emory as a whole, and put you in touch with faculty members that can serve to advance your career goals and serve as your mentors. After the first 6 months of fellowship, you'll start meeting with the CDC semi annually to get career counseling, and you will submit quarterly reports to make sure you're progressing appropriately towards your overall goals. You will find in our division an outstanding group of engaged faculty members, both locally and nationally. Like I mentioned before, several of our faculty are heavily involved in the School of Medicine as course directors of the pulmonary module, the critical care module, and the evidence-based module, all with ripe opportunities for fellow involvement. You will also have access to role models with an impressive portfolio of involvement in national professional societies. We have both SCCM and CHEST presidential lineage, as well as heavy involvement in committees and committee leaderships in all of the professional societies. We have successfully been able to get our fellows involved at the national level because of this. In the next couple of slides, I will address some frequently asked questions. The first is about meetings funded through the fellowship. You will have one meeting funded during your first year of critical care fellowship, and during your second year, funds are contingent on scholarly productivity. The second question is about moonlighting opportunities. These are available at Emory, both inside and outside the system. They are contingent on being cleared by the program director and count against your duty hours. Our fellowship does not include any 24-hour overnight call. Fellows will cover nights during their Grady ICU rotation during a 7 to 8 day stretch of night coverage only. During normal clinical rotations, fellows are expected to be on telephone backup from home for residents or APPs who are in-house in the ICU. You're expected to be available to come in if you're needed for urgent consultations or for procedures when you are on ICU rotations or on procedural rotations. Overall, fellows have at least 4 days off per month, and usually more than that. And in the past decade, we haven't had any duty hour violations. Our fellows are our biggest asset, and during normal times, aka non-pandemic times, we would be showcasing them nonstop, so you can personally judge whether you think they are happy here and not have to take my word for it. But not to worry, we've still set aside an hour on the day of the interview for you to meet and chat with our current fellows. I also hope you will check out the videos that they have painstakingly prepared, some of which are posted on our website and others sent to you in the pre-interview material. In closing, I want to thank you again for your interest in our program and for taking the time to go through this presentation. I hope that this material will give you a starting point in your search for the right program. We understand that this recruitment season is challenging for everyone. Now that we've gone through the specifics of the program, we hope to have more time to connect with you on a more personal level and get to know you better on the day of the interview. I, for one, can't wait to meet you soon.